Thank you.
Very
Yeah.
and we've brought all of you here together.
I got it. Yeah, I'm so late.
Convened
Sorry.
by DevEx, our partners, to talk about how is it that we can really capture the value of private sector contributions to further the Sustainable Development Goals. We have folks joining from their living rooms through the webcast. And I want to point out that two of our co-hosts, OPIC, the Overseas Private Investment Corporation, could not be here, as well as the Dangote Foundation. But between both of them, as well as our other co-hosts from GFF and DevEx, we've really put together what we hope is going to be an engaging, contentious, challenging, mind-moving, action-generating discussion for you all today. For those of you who may not know MSD for Mothers, we were created back in 2011 when MSD, also known as Merck in the US and Canada, made a $500 million commitment to ending preventable deaths worldwide. As we've done this work, we have increased access to quality of care and quality of family planning services for more than 7 million women in 30 countries, working with over 50 partners. And throughout the years, we have learned that we would not have gotten to where we are without partnerships. And that's part of the theme of today. So how is it that we can capture the value of private sector partners and create sustainable models for development? I think that there's a broad consensus that capital, private sector capital, is needed to close that financing gap, that $33 billion financing gap to meet the maternal and child health SDGs. But we want to posit that that's just the start. And if that's the only way that we think about private sector contributions, we are leaving so much value on the table. And so part of the conversation that we hope to have with our panelists today is to identify what that value is and how we can extract it efficiently, because at the end of the day, it's the outcomes for the women and children that we are all have the shared vision around. Some of the ways MSD for Mothers has, and I think about it as a whole continuum of action, yeah? So we start with the financing, and we've had experience through our development impact bond in Rajasthan in terms of bringing innovative financing to support quality improvement with local private providers. We know that up to 40% of women receive critical family planning and maternity care services from local private providers. They've really been left out for the most part from the conversation around the Sustainable Development Goals and quality of care. So that's one way we're thinking about working through this continuum of action. Another way private sector provides contributions through research and development. We've had a partnership with Ferring Pharmaceuticals and the WHO, where we've supported evidence generation for a new innovation, a heat-stable carbetocin, a uterotonic that's fit for purpose in low middle-income countries, so that women now have the ability, providers now have the ability to provide high-quality uterotonics for the prevention of postpartum hemorrhage. Another part of that continuum of action is how do we support system strengthening by bringing private sector capabilities and expertise. One example I'd like to share with you, our partnership with GFF, where together with the Gates Foundation and UPS, we're working to bring technical expertise to strengthen supply chains. And last but not least, when we think about those women and children who are receiving care from the local private providers, how is it that we can support that sector? Also the social entrepreneurs that are part of the healthcare delivery system, again, through this private sector engagement. So that's the conversation we want to have. There are many challenges around that. One of the things that we had a conversation with Raj and DevEx is for us to actually be able to measure our progress we need to know where we are right now. What's the current state? And when they asked the question, we actually realized we don't know what the current state is. The data doesn't exist. And so if we don't have that data around those private sector contributions, whether it's the financing, whether it's the expertise for health system strengthening, or whether it's the local private providers providing care, we're not going to be able to hold ourselves accountable or to track progress. And so I'm going to hand it over now to Raj, who can talk a little bit more about those findings and will also introduce our panelists today. So thank you all for coming.
Thank you. I got this one. Thank you so much, Marianne. Let me add my welcome to all of you. I love the energy in the room. This is a little bit of the Davos shuffle. I mean, those of you who are joining online didn't see it, but a little bit of chaos in Davos, running around from one event to the other. You all made it here. You're in the right spot, and we're delighted to have you. There are probably more than 1,000 people, I think, on the live stream right now. So I just want to let them know that this is a bit, you can't see everyone in this room, but it's sort of like the Hall of Justice in maternal health. We've got people who are in the leadership positions from every angle, whether private sector, funders, for-profits, nonprofits, people doing frontline work. It's really an impressive group. Science and tech is represented here. Investors are represented here. And there's kind of method to our madness at MSD for Mothers and at DevX and putting it together this way. You know, we all know, we all care on this issue. In fact, the survey will show you that. I'll talk to you in a second, that we don't really need to convince people that ending maternal death is a priority. Everybody's there. There are a number of challenges, but really it comes down to the fact that all the groups I just mentioned need to get together and need to actually take some action. And that's the goal of this event today, to dig just one level deeper, something we often do at DevX in our reporting, and we do it too in these kinds of events in person. So that's really our goal. Now, for those of you watching online who wonder, why Davos? One of the cool things about Davos is trend spotting. It could include footwear, by the way, seeing like, hey, what are people outfitted this year to survive the weather? But there's also a lot of trend spotting around, like, what are the big issues we're going to talk about in 2019? What's going to matter? What will be on the agenda? And what's interesting to me is, as editor-in-chief at DevX, is always thinking, well, what are the real things that are actually moving versus the issues or the stories someone is selling, but there's not actually a lot of change happening. Have we actually reached a tipping point? You will hear that word 1,000 times during a week in Davos. Are we actually there or not? That's something we want to explore today. And to get there, exactly as Marianne said, the best thing we thought to do is actually do some research. So at other events you go to in Davos, you may get Swiss chocolates or various swag bags. We have a report, okay? This is
Thank you.
This is a maternal health event. You get a report, but it's a pretty interesting report. It's worth your time. Essentially what we did is we surveyed 500 people who are working in reproductive and maternal health, the professionals around the world. You can see the methodology where they're based, but all over the world with all kinds of experience. And we asked them, where do you think we are? But that wasn't really quite enough. So we directly contacted people we know at 7 of the biggest funders of maternal health and said, where are you, especially on this theme of private sector that we've all been talking about, and tried to dig a little bit deeper. There is some really good news that comes out as you read through it. There are a lot of good examples. There's a lot of kind of broad consensus that we need to do better. But when you actually dig to the numbers, it's hard to find out what's really happening. And the main reason is the numbers aren't there. People aren't tracking this. Donors aren't tracking it. So there's a chart at the end. I don't want to kind of give you a spoiler here, but there's a chart at the very end called the donor index. And you'll see the very last column, even after quite a bit of good news in the other columns, is which of these donors has standardized data tracking and reporting, and the answer is 0 on private sector participation in global health, 0. So we need to get a lot better on that if we're going to make events like this, the work that you're all taking on, if we're going to actually move the needle. I did want to read, not to harp on challenges, but I did want to read something that I thought would maybe resonate with those of you in the room who work on this. There's just a little sentence here. So we talked to a bunch of people at DFID and USAID and EuropeAid and others, and they gave us great examples of where they're moving the needle, and they said this is something they want to do. Again, lots of real progress. But we said, well, why is it getting stuck? Where does it get stuck? And this is the very long sentence. Interviewees indicate that development policy, bureaucracy, organizational and cultural norms, risk tolerance levels, staffing, operating models, contracting protocols, and even industry language and nomenclature are some of the restraints inhibiting donors from pursuing more synergy with the private sector. Okay, this is why it's not easy. These are each one of those we could have a session on. This is tough. But if we care about actually achieving the targets that have been set, and by the way, we've had a lot of success. Maternal death is down 37% in the first 15 years of this millennium, of this century. We need to double the rate to hit the targets. We need set to a reduction of 7.5% every year. Every year. Double what we were doing prior years. To give you the kind of visceral sense, the statistic I've heard is it's 2 jumbo jets filled with women every day, if you want to think of it in those terms. So we've got a lot of work cut out for us to move this. We can't just have nice, happy conversations. We need to actually create some urgency. That's part of what we hope to do today. So with that, I'd like to get our panelists on stage to begin our conversation. And again, this is Davos. This will be a little freewheeling. I see a lot of experts in the crowd that we will turn to as well to get your thoughts. But please, Miriam Cleason, who is the director of the Global Financing Facility, please join us. You can clap. Very welcome to clap for Miriam. Julie Gerberding, who is the Executive Vice President and Chief Patent Officer. Patient. That was a misspelling. Patient Officer at MSD, and of course, and former Director at CEC. Where is Ifeyinwa? Okay, please join us. Ifeyinwa Ugochukwu, who is the CEO of the Tony Elumelu Foundation. Please join us. We may have another panelist in a moment if you're wondering why the empty chair. We've got somebody who's on their way. So I just wanted to begin the discussion because we're talking today about, Jan Wilhelm.
Yeah.
Apologies.
So sad that a man is being skipped.
We need a little.
Things have changed.
We need a little diversity on the panel.
Yes, we do.
Thank you.
Jan Wilhelm is, of course,
Statistics.
is with Royal Philips. Thank you for joining us. And we may have one other panelist as well joining us, by the way. Again, we're going to roll with the flow here. We're talking private sector engagement in global health. And there's kind of 2 sides to that coin. We want to start with the innovative finance part. And I want to bring Miriam into this discussion. I think people generally know GFF. There's a lot of folks in the room who've worked on making it happen. But there's some news on your end. So let's break that news. Tell us what's happening.
Yeah. By the way, since we referenced your report, I really like the way you categorize private sector engagement, systems expertise, tackle system bottlenecks. You bring out the private providers that we need to reach the poor in remote areas. And as you said now, it's how do we mobilize more money? And clearly when the GFF was launched 2015 in Addis Ababa, it was really to try to find ways to mobilize not just domestic resources, but also private capital. And what's really exciting for us today is to see how interested private investors are in actually buying bonds, sustainable development bonds that draws attention to women, children, and adolescents. When we started last year to work with Treasury, and it's of course a great advantage for the GFF Trust Fund to be located in the bank and have the Treasury, a AAA accredited mechanism that gives credibility to the field. So working with Treasury, and Treasury issued a series of sustainable development bonds to draw attention to women, children, adolescent health and nutrition. We met a $1 billion benchmark last year on the Canadian market, Canadian dollars translated into $1 billion in US dollars, and this January, a second billion. So we're now up to $2 billion in financing private sector money going into Treasury, and the job of the GFF is really to help countries to access those funds, make it affordable, and also ensuring that that money goes into results. So it's a very interesting partnership, and of course countries, mid-income countries, countries in transition, no more eligible for concessional IDA financing, sees this as a very attractive opportunity to draw in private capital for huge issues that remains. Indonesia has, I think, about 37 million of their kids, 37% of their children are still stunted. Guatemala has a huge stunting problem. So we are really trying to see how we can partner with the bank, access those finances, and bring it down to a level that countries can use this catalytic financing to address remaining huge health nutrition challenges.
We get in a little trouble at DevEx when we write about innovative finance from many of the people maybe in this room who say, what's so innovative about it? This stuff has been around forever. I think the innovative part is actually doing it.
Yes.
Conceptually, it's not that complicated.
No.
These are countries that have graduated. They can't get concessional loans anymore. But actually doing it, helping to bridge this $30 billion gap, there aren't as many examples as we would like to see. This is an impressive one, but there aren't that many.
No, and I think the other innovative element of this, how do you achieve those results? It is to ensure that you have a country-led multi-stakeholder platform where the private sector is present. It is to draw in, as we do together with Merck for Mothers and UPS, expertise, global expertise to address systems bottlenecks. And it is to really purchase for performance, not just from public but private providers, so that we reach those where we can have the greatest results. So it's an interesting multi-level approach that is, I think, the innovative aspects of this.
And Julie, I hear you at MSD saying something very similar to what I hear the Gates Foundation say all the time, which is that it might seem like a lot of money that we're putting into this space, but it's actually pretty tiny. If we don't find a way to leverage it, it's nowhere near enough to actually solve the problems we're here to solve. So we heard Marianne at the beginning talk about a big financial commitment. It is a big commitment, no doubt, for any company to put that up. But I think it's important for people to realize that private companies giving those kinds of donations, that's not the whole picture, right? So maybe you can describe a little more what else is MSD for Mothers actually bringing to the table besides the money, and how does it fit into this innovative financing?
Thank you, and thank you everyone for being here. It's really inspiring and energizing, so we'll leave here even more committed to get through our third trimester of Merck for Mothers, MSD for Mothers. So, when MSD for Mothers was conceived, it was built on a trajectory of a company that had a tradition of doing a few really big things, like the Mectizan river blindness program, like the full tech transfer of hepatitis B vaccine to China for no charge, and similar programs that are large in scale and either blueprint programs or programs that are sustainable over the long run. But this was a different domain, and it was not an area that was commercially relevant to us. But the more we thought about what we bring to the table as Merck, we realized we have certain capabilities that seem to be lacking in a lot of global health environments. Supply chain, for example, is a common problem across almost any global health situation. We actually know how to influence providers. We know how to influence their beliefs and attitudes and behaviors around drug prescribing and vaccine utilization and so forth. So we have a lot of knowledge about marketing, social marketing, how to use omni-channel approaches to inform and influence people. We have a lot of capability in terms of managing very complex organizations, because everything we do is, so you think about even just making a product end to end, that's a huge diaspora of talents and capabilities and very diverse expertise that has to come together to focus on a single problem. So in this area of maternal health, which we did not define as a pressing need, but at the time we went out and asked health ministers and multilateral leaders and thought leaders in global health, where could a company with our capabilities be useful in solving an important problem? It wasn't uniform, but the most common answer we got was to help fulfill the Millennium Development Goal around maternal health. And so that's why this area was chosen. And when we selected it, we wanted to specifically identify projects that would be proof of concept, potentially sustainable, potentially scalable, that would really result in either something really important to be learned or something that would change the game. And of course, last but not least, I have to say that what do we really do well? We invent drugs, develop them, and bring them to market. So it was kind of natural when we recognized there was a missing drug in the armamentarium to address maternal hemorrhage, that we would also utilize our core capabilities in drug development and bring those into the Merck for Mothers model. So this $500 million investment over 10 years was designed to be thoughtful about how we as a private sector contributor leveraged our capabilities, but also when we look for partners to recognize and respect what other private sector partners bring to the table, but also what the broader community of talented, dedicated, and passionate people and their organizations also are necessary to the equation. And I think if I could summarize in a soundbite, probably the most important overarching framework for this is purpose.
One very quick follow-up. So you've been at this since 2011. You've had a number of partnerships. What have you learned? What things are working and what things maybe aren't? Or how have you evolved your thinking since 2011?
You know, whenever there's a hard problem to solve, and preventing maternal mortality is a really hard problem on a global basis, it takes a wise crowd. Nobody can solve this problem, no matter how strong and good they are in their lane. We have to create a network of competency and diverse expertise and opinions to address the problem. The issue is, how do you actually manage such a structure? One really important make or break concept is the partners need to have alignment around a shared goal. And if you don't have alignment around that, I think the partnership is pretty much doomed to fail. Second, you really have to understand what your capability set is, but also be respectful and willing to listen and learn about what the other partner's capability sets are and what they're bringing to the table. You almost need to inventory who's able to do what and really make that visible and concrete to everyone who's participating. Because we all have strengths, but we also have things that we don't do well. And if you develop a sense of what's necessary to get to the result you're trying to achieve, you'll discover you have some gaps. And that's a clue that you need another partner, or you need to invest in something that will buy you that capability. So I think those are the three biggest things: the alliance, the contribution of your strengths, the mapping of what other capabilities are needed, and then finally measurement. You really do need to have an objective set of criteria to evaluate the progress that you're making, and a culture of operation that understands that doing that in a transparent and objective way benefits everybody in the partnership. And you know, I think, as you saw, or as you mentioned, we're not there in terms of the broad view of private sector engagement in global health issues, but I think in the context of MSD for Mothers, we've made a lot of progress there, and we're really proud of the measurement systems that are evolving and our ability to show proof of consequence. And it matters when we're doing impact bonds, because we have to be able to demonstrate that what was supposed to be accomplished really was accomplished. So that's been a big lesson for us, is how do we actually develop credible examples of results, not just processes.
Well, we didn't plan this, but that is a perfect segue to our next two panelists, because there's really two sides to this coin. When we talk about private sector engagement in this issue, one side is innovative finance. I think many people, their minds go directly to that, especially if you work in the finance world. You might think, how do we generate more funding? That's got to be the issue. It's a $30 billion gap. But a very related other side of the coin is, well, if you're generating all that funding, it's to achieve results. How do you achieve the results if you're not engaging the private sector? How can you do this? Obviously, every context is different. Every country is different. But as the report will show, this is a key element to it. So I wanted to bring in Ifeyinwa and Jan Wilhelm to talk about that element. You're working at the Elumelu Foundation on the ground, particularly in Nigeria, but all over sub-Saharan Africa, developing entrepreneurs, building that private sector. How do we get the private sector, the actual ground level, including the last mile or frontline people, engaged in this kind of conversation? We're talking about billions, and we're here in Davos.
Thank you, Raj. And thank you, everyone, for being here today. I think I want to start with the point that all 17 Sustainable Development Goals, including the problem of maternal mortality, comes from poverty. Everything boils down to poverty and lack of economic opportunity. And that is why at the Tony Elumelu Foundation, we looked at it holistically, and we said, if we can build a generation of strong small and medium enterprises across the continent, if we can empower entrepreneurs who will then trickle down into their families and communities, you know, revenue and job creation, that will, who will then trickle down into their communities, then we would have solved 70 to 80% of the problems on the continent, including maternal mortality. So that's why in 2014, Founder launched a $100 million commitment to identify, train, mentor, and fund
10,000 African entrepreneurs across all 54 African countries over 10 years. So this will be our 5th year, and to date we've trained and funded 4,470 entrepreneurs. And last year alone, we had over 150,000 brilliant entrepreneurs across Africa apply to the program, and we're selecting just 1,000 a year. So that's just barely scratching the surface.
Yeah, it gives you an idea of what the potential is if we can better connect.
Exactly. So to give you an example, so we didn't set out to tackle maternal mortality, but one of our entrepreneurs, his business is called Help Mum, and he has a mobile app that shares information with rural women on when their antenatal care is coming up, where they can find help, just general information to help them with better care during the pregnancy. And then they actually give out clean birth kits, clean towels, scissors, things that will give them a slightly better chance of having a safe delivery. And that's one of our entrepreneurs. And we have about 5 others who are directly involved in maternal mortality. We have over 250 entrepreneurs in healthcare. So this is just an example of what it's like on the ground. And that's us who didn't set out to tackle maternal mortality. So the model that we're using is that by empowering entrepreneurs, we're actually tackling the problem 2-pronged. One, if we create economic prosperity, there will be less mortality, because people who are able to have the money to have good healthcare will not have that problem. Secondly, the indirect result of the work that we're doing is entrepreneurs such as Help Mum, who are actually on the ground frontliners. So I would say that the one way to engage the private sector is to build entrepreneurship, because the passion of entrepreneurs is what ensures that the 30 billion that you spend will actually create the results, because their business is actually directly involved in creating the solutions that we're looking for. So I think that the empowerment of entrepreneurs is one sustainable model to help tackle the problem on the ground. And that's the model that we are applying, and we're seeing massive impact across the continent.
Yeah, one of the themes I pick up going to a lot of these Davos events, the thing that can be frustrating for people is they think there's an obvious problem. Can't there be a direct line? We all want to fix this. There's got to be some direct line where we can just, and I think of it almost as the stages of grief. And at some point you get to acceptance, where you say, this is really complicated and hairy, and it's a systems problem. And we need every element. And you need to have entrepreneurism on the ground. You can't just come in as global corporations. On the other hand, you can't just have local entrepreneurs. For an issue like this. You need global corporations. That's my segue to you, Jan Wilhelm.
I was thinking, where are you going?
So you're Philips. I think everybody knows Philips, but they may not know the commitment you have, especially to Africa, and how much of a part of your business plan that is.
Yeah.
So I thought maybe you could connect your business directly to this issue and talk about the market a little bit. How do you approach that market?
Sure. So I want to go back to the issue of purpose. So in your introduction, you said purpose is a big theme. If there's one change that we've seen in Davos over the last couple of years, is that purpose. I went to the Edelman Trust Barometer, which some people may have seen, and they said that employers are trusted, and they're trusted a lot, but they do need to have a sense of purpose, and they need to show their societal relevance. And if you look at that, more than 65% of the millennials actually want their employer to be societally relevant and be measured on it in non-financials and be rewarded for it. You see that a lot of the corporates are actually changing. So what is the purpose of my organization, and how am I going to use my capabilities to the point to actually solve this? So then if you look at the situation at Philips, we defined our purpose a couple of years ago to say, let's improve the lives of 3 billion people by 2030 and measure that, and let Ernst & Young figure out if we manage that and publish that just in the same way as we manage our financial performance. But 3 billion people could be, Bill Gates, who doesn't really need my attention, or it could be really poor people. So we said after a couple of years, let's go and refine it a little bit. Are we still fulfilling that purpose? Are we still contributing to solving inequity? So we developed an additional purpose to actually improve the lives of women and children, and in the meantime also men, in sub-Saharan Africa and Southeast Asia. And we said, well, we're going to touch 300 million people's life. And so suddenly we're going into rural areas, and we got there in 2 ways. One, to come back to your entrepreneurship area, is we used to be a lighting company a long time ago, and now we're purely health tech. But we started with introducing light in some communities, and we said, what happens if after 6 o'clock you switch on the light? Put a couple of solar panels, switch on light. well, we thought that people would start playing football, which indeed they did. And so that's why FIFA liked us very much, and let's put lights everywhere, and people will start playing football, which is really good for society. But what would happen around the rims of that was that people were convening and started, teaching, learning, because there was light, they could actually read, micro activity, entrepreneurship, and stuff like that. And then some of the community people were saying, we need a hospital here as well. Could you just put a hospital in the middle of the football field? We said, well, let's put it right next to it. And then, so just by light, we started to introduce healthcare, and then we started to see, well, who's actually coming? Well, 70% of course, are women and children. So that's how we rolled into modern childcare from that perspective. So by accident and hazard, but with a sense of purpose that got us there. The other direction was, we started with, we are very big in healthcare and tertiary care. So hospitals is our comfort zone. So one of the South African hospitals in Cape Town was complaining, not in Cape Town, sorry, Johannesburg, was complaining that they saw a lot of women at their doorstep at the ICU bleeding to death. I said, pregnant women in an ICU complex. There are there's two people I have to take care of, make me a NICU, a neonatal intensive care unit. And by the way, can you find out where they come from? So we followed their journey. And that's one thing that private sector does quite well. We understand consumers. That's why we have a proposition that sells. So to understand your consumer journey is one of the core assets that we know that private sector can contribute. So if you want to understand your consumer, so pregnant woman, traveling, not having money, being referred from one incompetent level to the other incompetent level, bleeding to death, that created for us the pathway to saying, okay, so what if we would improve that? And through that channel, we also came at the community level, again, light, and then through intensive care unit. So that told us to focus on that primary care settings. And I think there are a couple of things that private sector, so corporates in collaboration with NGOs, donors, local communities can do really, really well and can do practically. But it starts with that purpose, and that purpose creates trust. But what we see in healthcare and global health, that trust is still something which needs to be built and is fairly slow. Early this morning we had a session with universal health coverage. We used to be outside the room. Now we're invited inside the room. We can watch. But we're not quite sure what we need to do as private sector in the room. And so now, but we think we can contribute in terms of innovation, in terms of our financial capital, our business modeling. We have developed quite some good business models in private sector that public can adopt. And the capacity building of the recipients of this support to actually overcome some of the technological barriers that can transform healthcare at scale.
I know there still is definitely frustration among many in this field who feel like private sector is sometimes allowed in the room, but not allowed to have a real seat at the table, right? Yeah. One thing this report shows, as we talk to people who actually work in this space, is that they don't think it should be a fight between public providers and private, that this is all complementary. In other words, the demands are so massive, the requirements are so huge, that if we get into that game, we will never achieve the goals. So I think that's a critical element. The other one, you talk about consumers, and that's obviously your mindset, right? Yeah. There's probably 100 other sessions going on around Davos right now that aren't talking about maternal death, but that are talking about health tech, which is moving really fast. Consumers are going to be able to access all kinds of technology directly. And so whether or not we like it or whether or not the international systems are set up for it, the train is moving. It's moving very, very fast. So the question is, are we going to be able to work with it? We've got, as I said, a lot of people in the room who have a lot of expertise in this. I want to call maybe on Steve Davis if I can. Just sort of keep us honest. If we have a mic, I'd love to bring one to him if it's possible. Just keeping us honest. So at the very beginning of this thing, I said, maybe this is the real thing. Maybe there's a tipping point. We actually have some real examples of innovative finance. Bonds are being floated, right? We have big corporations engaged in this at a level we didn't have years ago. Where do you see kind of the moment we're in? Are we at a tipping point? Is this a true change in the dynamic?
Yeah, well, thanks, Raj, for calling on me out of the blue.
You're used to that. You're used to that.
Yeah, I am. Yeah, I don't know. Tipping point's pretty dramatic. I mean, this is an evolution, but I would say there's a few things driving this in our favor. One is, I mean, frankly, the demographics of the globe are driving it more than anything. That you actually, what used to be a pyramid we talked about the bottom of the pyramid is no longer, it's no longer a pyramid, it's a funny shaped diamond. And that means that so many more people are living who used to be at the bottom of the pyramid are in the lower middle income new consumers, which drives corporate engagement, and that's a positive thing. So a lot of, I think, the reason we're moving more to more corporate engagement on these issues is the times and the issues and the purpose, but there's actually a really important and vital and positive demographic shift in market displacement, which is good.
So you mean more countries are becoming middle income?
Yeah, and so there's incentive, and it's great to have people think about, and also gives more agency to the people that were our beneficiaries in the past to be consumers tomorrow, and I think that's a good thing. But I do also think there's new models being tested consistently. We were in path, for 40 years with a lot of private sector, and now we're doing a lot more than we ever had. So everything we do has private sector. But two comments I'd make. One on that. I do think we have to be careful that when we say private sector, we just don't mean multinationals, which tends to be the way it is at Davos because they're the ones that pay the bills here. But there's a national level private sector engagement. There's social entrepreneurs, and probably the most important private sector player in the whole space is the frontline private sector provider of all sorts. And I think we're going to have to innovate the way we do the urban primary delivery in order to get them involved, because that's where people are going to get their services. The second piece I would say is in terms of employee engagement and corporate engagement in the space. We've done a lot of work on what drives engagement, and we work with tons of different companies. And increasingly, particularly with the digital side of the equation, the high tech, is to, instead of going and we have a problem and we'd like you to pay us or give us assets or give your expertise, it's actually going to the Amazons and the Tableaus and the Boxes and the Twilios and saying, we have a problem, can you help us solve that problem, and can you get your talent involved in helping us solve the problem? And that's brought, we've tripled the number of relationships we have in that space with that.
Yeah, and I think you're absolutely right. The money is important, but if that's what we think we're getting from the private sector, we're missing the boat. And the private sector is already moving fast, especially on the ground. I mean, in urban settings where you have massive influxes, just even domestic migration, people who are not registered, not necessarily have birth certificates, aren't on the grid, but have tremendous needs. There are health providers there of all kinds. And if we don't access them, credential them, work with them, we're kind of missing the boat. I want to go back to our new panelist. You just saw somebody join us on stage. Do not be sorry. This is very classic Davos. Dana Barsky is the Chief Operating Officer and Head of External Partnerships for Impact and Advisory and Finance at Credit Suisse.
Long title.
It is, yes, we will pass you a mic if that's all right. It is a super long title, but it's also very hopeful for the conversation we're having that Credit Suisse actually has a unit dedicated to impact finance. That's got to be a change of some kind, as we talk about trend spotting, and reports directly to the CEO of the company. So maybe tell us where does this fit in, especially with a health angle?
Well, I have to say, I love the conversation I walked into. I mean, our entire division has been created around purpose, profit with purpose. And it really comes from the history of our CEO, Tidjane Thiam, who was actually the development minister of the Ivory Coast. And it's near and dear to his heart. And I truly believe, it's actually in my title, very long title, but it's COO and Head of Partnerships, that exactly to what you were saying, we cannot do this. We shouldn't even try and do this unless we all come together, because I mean, there's a $3.5 trillion funding gap in the Sustainable Development Goals, and philanthropy is about $1 trillion of that. So we need to bring private capital to these solutions. And coming from a bank, I will talk a little bit about, though, the importance of capital. And I think there's a role. I think we need to bring capital market solutions to a lot of these problems. So it's not about the money per se. It's about having enough critical mass to solve these problems. And there's a role for everybody. There's a role for philanthropic dollars. There's a role for foundations. There's a role for development finance institutions. There's a role for multinational corporations, and I know the work that Phillips is doing is fabulous. And then there's a role for banks. And if we can come together with creativity, then we can really solve this, and that's what's super exciting.
I mean, a good example are the development impact bonds, where the first ones took like 2 years to structure and figure out. The next one's like a year. The next one's 6 months. There's still not that many of them, but if we can turn them more into products, plain vanilla products that people are used to, they understand how they work, that's the kind of thing the banking sector can do that's really hard for everyone else in this space. And you know, if you think about what GFF is doing, and Steve's point that countries are moving up the income ladder, great news, but it creates a problem for those countries. Now that they can't access concessional financing for their health needs. Well, a very innovative tool like GFF can go out and raise money in the capital markets if it's structured right. And in theory, the $2 billion you're looking for now is tiny. It's the amount. What are assets under management over credit?
1.4 trillion.
Right, and you've got people like, as Jan Wilhelm saying, employees, investors looking for purpose.
And coming together, we can solve some of the biggest issues like maternal health. I mean, that's something that we can come together and really tackle. I truly believe that.
So it sounds like we have a product. We even have some bonds, but we may need more. We have development impact bonds. Of course, we may need more. And again, to this broad theme that I tried to introduce the session with, and just thinking about where are we, I hope all of you will, as you listen to the rest of this today and as you leave at the end, to think, are we over that tipping point? What can I do to help us get there? And to that point, I want to bring in another person who's in the audience, Maria Rosa Coutillo. If we can pass a mic. Does this one work? I'll pass it over. And you lead partnerships at UNFPA.
Yes, and I understand I have 2 minutes to start the fire on this, and I am Italian, as I always say. But I understand that I have to do two things to start this fire. One is to make a couple of observations,
Please.
And the other one is to make two questions. Now, I think you started at the beginning by saying there's a gap and we need to fill this gap. So the first thing to say, on which we need to be very clear, is that the 2030 deadline is a deadline that we cannot miss. So we need to find a way to meet that deadline. It's not a nice to have. And the second thing, going back to what you were saying, Raj, that this is, let's say, an environment where there is a setting of trends on many things. So in these 2 or 3 days I've been here, I've been hearing many words, the usual one, let's say the trendy ones, the ones we always work on. Partnership, public-private, I'm very passionate about that, so I'm a full supporter. Innovation, digitization, data. So sometimes I am afraid that we are not on the same line, in the sense that the language we have at the UN, and I came to the UN from the private sector 3 years ago, so I have this point of observation. I'm afraid we're not talking about the same language. Sometimes there's still a confusion between funding, financing, bonds, very fascinating. But as you say, how do we get there? So this is my first question. Are we all clear about what we are talking? We have a lot of exercise with Jan Willem. We have a partnership with Philips. It's an everyday exercise to align the language, I guess, no? At the beginning, it's not been easy. We took a long time to reach there, but little by little, we're reaching there. It requires effort, and it requires really aligning the words. It seems a simple thing, but it's not. It's complex.
Yeah, the language is just a symptom of the broader lack of alignment that we have across different kinds of organizations.
Where I think I'm a full supporter of partnerships. Again, I am a pragmatic dreamer. I think we can arrive. We can reach the 2030, but we need to be pragmatic. So this is the first thing. The second thing, the importance to learn, and you say that in the report, it's very important, to learn from the practices, not reinvent the wheel all the time. Sometimes I also feel we always reinvent the wheel. It's important to listen, to be open and empty to what is going on. So that's the second type of conversation. And for example, we are learning a lot from a partnership with Merck, from others, in supply chains, where we talk with women every day about sexual and reproductive health and rights. So the second question is, are we really learning from these practices, or are we always reinventing the wheel? I think you asked me to be provocative,
That's
so
perfect.
I think
That's perfect. You were provocative, and I think it's a really good question. Are we learning? Are we learning? I asked you that before, Julie, for that reason. And I think the truth is, if we're not all learning and learning fast, there is no shot at hitting these goals. Any response from folks in the panel? Go ahead, Miriam.
And of course, we in DFF think that the most important learning is governments to learn how to engage with the private sector. That's where the learning has to happen. There is still an enormous insecurity. How do you contract with the private sector? How do you partner? How do you engage? So that's one thing I would say about the conversation. The other thing is, I think the conversation we are having here should be had throughout Davos. because it's the conversation around investing in people, mothers, newborn children, which we know now through the Wealth of Nations account for about a third of growth. So we should be talking about this, about not just the survival, but the health of populations and the nutrition and the education throughout, if we care about not just growth, but security.
Go ahead.
I would just say we are trying to learn from our philanthropic efforts, and I think that's so rich. If you could take, because we've been doing that longer, right? Everyone here has been doing that longer, and if you can turn your philanthropic work into something that's disciplined and measured, then you could take best practices and use that in impact investing and in bonds and bring in more capital and make it more, almost more professional in a way. And I see that as a trend, and I see that as an important learning opportunity for everyone.
I totally agree. And that we have learned so much in the last 5 years, because what we're doing is a new way of engaging in Africa. It's a new way of giving development finance, and that's giving it direct to the hands of entrepreneurs. We've always said that capacity building and trading and funding are two sides of the same coin. You can't have one without the other. If you just do training and capacity building for the entrepreneurs or for the service providers, it's just theory. How do they prove the concept? How do they go on the ground and start businesses that will create impact? And we're seeing massive impact with just 4,470 entrepreneurs. Imagine if we had 1 million. So we are working at the bottom of the pyramid. We take each entrepreneur, take them through a 12-week online training program, which they've likened to a mini MBA. And after they're completed, Accenture assesses their business plans, and if it's certified, they receive a $5,000 seed capital. In the world, it's not much, but for them, it's the difference between having that idea stay in their head for the rest of their lives, or turning it into a business. And what we found is that they have gone on to raise millions and generate millions and create thousands of jobs. So imagine if we were able to do this across the continent for millions of entrepreneurs. And that is what we're learning, that the impact is when you engage with the entrepreneurs directly. They are the real private sector.
And it's an important message even for governments. Governments have a view of health, not just as, well, it's a basic service provision we have to do, but instead if they have an entrepreneurial view and say, actually, this is a market.
Yeah.
We can support entrepreneurs in this, we can support small and medium enterprises, we can support a broader ecosystem. That starts to change the dynamic.
Yeah.
Just to add, because you asked if there were a tipping point, and at least there's the trend, and we've been talking about the growing interest in so-called innovative finance, but I think the trend really also is fueled by something that might not be obvious to everyone here, but that is a growing interest in wealth investors and family investors who actually aren't investing because their life depends on it or even their business depends on it. They're investing because they have capital and they want to put it to some useful purpose. Yes, they want a return on that investment, but they also want to be able to feel as an individual or as a family or as an organization that they're doing something that's really purposeful and matters. And we see this trend coming into our world of corporate murk in a number of ways, one of which is that investors are asking us more questions about what we actually are doing in the environmental governance and social space. So we're getting more and more inquiries about our activities from wealth investors, but increasingly from traditional investors as well. So that's signaling to us that the people whose money is being put into investments are beginning to actually want transparency and is more concerned about this. So I think that's an energy that hopefully will continue to propel these kinds of investments. And the opposite side of that is what's going on at a country level, where many Western people or people who live in highly developed countries don't actually realize the capacities that exist and are growing strong in many developing countries. And most developing countries do not really want to be donor states. They would very much like to have finance facilities and investments that allow them to free themselves up from the more traditional donor model. And that's a trend that is starting to come together with the investment trend that I think, hopefully will someday truly tip us into a place where we really can think about more sustainable models.
And I think it's easy to fall into this trap, and I hear this, maybe many of you do too, during this Davos. People are talking about Paris. Oh, there's people on the streets, there's protests there, or talking about the Trump administration in the US, or talking about dysfunction in many countries around the world, but thinking of it as kind of one-offs. Instead of saying, hey, we've got a systemic global problem here. If we don't start aligning capital and business and initiatives, whether they're not-for-profit or for-profit, with goals like the Sustainable Development Goals, where are we going to be? So we don't want to wait for the next crisis. We need to generate that urgency somehow. And again, to generate that urgency to double the success we've been having in maternal health every year until 2030 is not going to be straightforward or easy.
So I want to come back to the learning point and the risk of not learning. And we've seen that in particular in the digital area. The digital transformation in healthcare is phenomenally so fast. It's incredible how fast that is. And it actually creates inequity because those developing countries who are just starting to move away from the Excel spreadsheet to the next level of IT, it's very difficult for them to catch up. And a couple of years ago, we did some research on about 120 emerging markets to understand what their health IT market needs were and what they were expecting. And everybody wanted to learn by themselves. So every country was saying, I want my health IT strategy, my health IT solutions. I want it proprietary. I want it free of charge, of course. And I want to reinvent the wheel 120 times, basically. That was the message we got in. So we came back and we said, it's not investable. You can't invest in 120 propositions for emerging markets. So if we're not learning, especially in the digital space, from each other, and we're going to stay analog in global health for a long time. And is that something we want to be in 2030? We still want to be analog in global health and maternal health? No. So how do we make that transformation? I think some stand out, like Rwanda is a perfect example. You first visit the artificial intelligence doctor, then you get the telehealth consult, and only in the third instance do you actually go see a doctor. And that is a bold move. That is something which you can't even do in mature markets. But it's that kind of learning that people should replicate. And so are we ready for that? Because if you start to accelerate, like digitization is accelerating the improvement of healthcare in the mature markets, in emerging markets, your maternal health problem shouldn't be that big of a problem.
Yeah, and if you think about the health workforce, there's some statistics in the report around the gap on health workforce. That can't be filled by the target date alone, just by training up people. We need to find other approaches, tech-driven approaches to do it.
Yeah. I gave you one example of how so there are a lot of midwives, for example, in Kenya, who are unemployed. They did the training, Amref or Aga Khan or one of those trained them, but there are no real jobs for them. And so they go around just, checking out antenatal care, and they want to do better antenatal care. And so you now have ultrasounds in the market that actually go and help people remotely to do it. But that still doesn't please the radiologist because they want to control over the scan. But now with digitization, you can actually connect the radiologist from his great hospital somewhere in Nairobi to somebody who's in remote Mandera trying to take a scan and remotely coach them, remotely tell them, and remotely tell, send me that image, I'll help you, I'll do the diagnosis for you. I just need your hands in the field with a piece of device which is on your mobile phone. That is revolutionizing antenatal care. And instead of the 25% of women that now get an antenatal care visit and an ultrasound before week 24 just to confirm the complication, you can now start to do predictive screening and actually understand 100% of the women and refer the high-risk cases to hospital. So it's going to be, it's there, technically possible.
Right, the technology is not really the barrier at this point.
Exactly.
That's moving at the fast pace we need it to.
Exactly. And you just need to comprehend how that is disrupting your health system that has been around for decades and completely changing the relation between the radiologist, the community health worker, the volunteers, just because technology allows that disruption.
I want to go back to those of you who are in the room and see if there are interventions people want to make. I see Toyin Saraki is here. John Simon just walked in. We have another one in the back here. So we'll if there's a mic that we can bring around, we have a mic. Maybe we can start here in the second row. And I just again, on this theme of what is the trend? Are we there? Are we talking a good game, but this isn't really happening? What are you seeing, Toyin?
Well, I really like the...
It's on. Should be.
I really like the theme of learning. Is it on?
Yep, go ahead. Just talk. It should be.
Just talk.
Oh, all right.
Likewise.
Thanks.
Hi, everybody. I really like the theme that we're progressing so far with the learning, with the learning from the interventions and with the hands in the field. You know, the data is great, the tech is great, the private sector has brought us incredible innovations. I was mentioning earlier to Steve that when I was campaigning for Uniject to be accepted in the 36 states of Nigeria, I never knew it was going to end up as Cyanopress. And now it's going around and it's available to people. But we must continue to measure that progress when we take innovation from the private sector. In 2004, I myself started Mama Kits, the clean birth kit in Nigeria. But I started it as an access to health. Somewhere along the line, Mama Kit became so popular that it stopped being an access to health. It's supposed to be a sterile birth kit to deliver the 5 cleans: clean hands, clean perineum, a clean cut, a clean cord, and a clean cloth. Now it's being handed out to mums who take it home. 5 months, you can't guarantee the sterility. Somebody's making an awful lot of money on Mama Kits, but guess what? The latest research showed that a clean birth kit to a mum in her house is not reducing mortality. It's shifted the responsibility. Hospitals are supposed to have disposable clean birth kits. So I'd like to encourage the entrepreneurs to sell to hospitals. Don't hand it to a mum. And private sector, we are working on a primary healthcare system to try to see if we can replace a failing public healthcare system. But we need to have innovative financing. We need to have lower interest rates. We need to make sure that there are 5 types of insurance so that we're not chasing up people for the fees. But I think we can do it, so good luck, everybody.
Thank you. I think we can do it too. In fact, one of the things in the report, you can pass it up to John here. I think one of the things in the report is that there's actually a lot more domestic resources. There are more health insurance schemes in a lot of countries. Countries are increasing what they spend on domestic health care. So there's trends that suggest we can actually make real progress here. John, you just walked in.
Yeah, so apologies for being late. I'm suffering from the Davos disease of perennial lateness and overbookedness.
But you know, there are a lot of topics you could talk on here. Being on the board of the Global Fund, there's replenishment happening there. In particular, you're an impact investor thinking about the innovative finance opportunities in health. I'd love to get your take on, are we in a new moment on this? You've been coming to Davos a long time. You've been working on it. Is this a new moment on innovative finance for health?
Well, you know, it's interesting we use the term innovative finance, and we had this discussion not too long ago. I mean, I think we should think about it as finance. I mean, we are trying to finance, and we should use the simplest, most easiest to do, and sometimes innovative finance is an excuse to do something overly complicated, and sometimes it's a belief that somehow there's a magic printing press of money, that if we just find the innovative finance door, inside is a big stack of money that doesn't exist. I think what we need to think about is we have these interventions that we know make a difference. And if something truly makes a difference, there is an economics around health that is sustainable. People will pay for their health care. So governments have a responsibility for financing a portion of the healthcare. So somehow, if we can find business models that capitalize on that, we can create financing mechanisms that allow for those to be rolled out and expanded. And as long as we are leveraging what already exists, and that includes what people pay out of their pocket today, which is more than what is paid for from any other source in developing countries. That includes the various streams that are coming from places like the Global Fund, places like PEPFAR, places like President's Malaria Initiative. You have all these streams coming together. Often they're running in parallel instead of coming together on a single platform to be more efficient. If we can figure out ways to bring them together, we can get something of a step change in the resources that are available, and then we have to think about what are the best ways to put them to use. So I'll just end with one last comment on what we think of as innovative finance. We need to ask ourselves every time we think of a new financing scheme that's going to be, you know, very heavy in transaction costs and very heavy in time to market and cycle, what exactly are we getting for that effort? Are we getting more efficiency? Are we bringing more dollars to the table? Are we creating more of a transition to a domestic financing system that's sustainable over the long term? If we can do those things, and those things are eminently doable, then I think we can create the financing necessary to bring a lot of these innovations to market.
Mary, maybe you could pick that up from a GFF perspective. You know, how do those those kind of tests, John's tests about innovative finance, how do they apply?
I
in your
really
case?
like what you bring to the discussion, which is it's not just about mobilizing more money, but it's really about effectiveness and development effectiveness, right? It's about efficiency and effectiveness. And that, I think, is very critical right now, where we have many different global health funding mechanisms in private sector. And as you say, this is about finance. What has really encouraged me in this now soon 1.5 hour conversation is we have not once talked about cost. We talk about investments instead of cost. So we have come quite a long way. And I think the only thing that's been missing from the conversation so far is that there is also something around accountability and governance that has to be an essential element. You talked about being professional and serious about this business. It is also making sure that when we purchase for performance, when we have results-oriented mechanism, which is what I think is buying the effectiveness, not just more money into health, but getting more value for the money. It is also about ensuring strong accountability mechanisms. That will attract even more, I think, private investors into this space.
Yeah, absolutely. The results, as Julie said earlier, that's the essential element.
Yeah.
And it's easy to gloss over that and focus on the things that look exciting, the big dollar amounts, the replenishments, but actually at the end, if the programs don't deliver results, there's no point. You wanted to jump in. We passed them. Yeah.
To be a little bit controversial, make it fun. I love the concept of simplicity, effectiveness, focus on cost, but I guess I would take the other side, which is then you got to be innovative. I know the term is thrown around, so I'll give you that, but from my perspective, when I'm working on structuring things, I think the best way, as I said earlier, in partnerships is bringing people together to really slice up the capital structure and put people where they can do the best good, because everybody's got a different purpose. You're a foundation, you're a development finance institution, you're a private sector company, and it's hard. I wish it were easier. So I love the idea of being innovative, and I try to be innovative in everything that I do. Yeah, I wish it were easier though. But anyway, just to take a little bit of a challenge on that. So.
Yeah, well, the money is there, right?
The money is there, but it's we need to come up with new and creative structures to solve the problems, to get to scale. And as you said, a lot of the instruments that have come out are small, and we need to now be creative to scale them up, and that's going to be critical.
How big do you think your sustainable development bonds can get in theory? I mean,
in theory, they can just continue to grow, right, from $1 billion to $2 billion and further on. But that's, I think, at the heart of the discussion here is helping countries to tap into those resources for results is really where we have to go. And of course, we are not just talking scale here. We're talking about scale and sustainable financing. Yeah. And that's why domestic resources are so important and critical to get the government ownership and buy down and a transparent budget against which these resources come in.
Right.
So to me, it's a complete change from the old development finance model to a new way of doing finance.
Can I just, we've talked about scale, speed, accountability for results. I think a fourth thing that's on my mind, and maybe I'm too hyper, but is speed. Because we've got 2030 looming large. It's not a very long time from where we are now, and we think about what it takes to build these funds, invest them, get the results we need. To me, one of the criteria for a successful framework for a new investment is, can we mobilize that capital fast and put it to work quickly so that we have the longest possible lead time to get the results that we're trying to achieve in the context of the SDG.
Yeah. You're thinking exactly the right way, that we need that urgency. I wonder, Jan Wilhelm, and we're kind of getting toward the end of our time here, so this may be a wrap-up comment from you. Oh, we have some questions in the back too, who we will go to. But quickly, companies like yours, you've got a time horizon, and you've got to hit results, right? Yeah. What's your biggest stumbling block now? If we wanted to take Julie's call to action here on speed, what could you use that would make things move faster from your perspective?
Well, it's this financing thing. So I think it's fairly easy to like we do with UNFPA, but also with AMREF in Kenya. We want to unlock $1 billion worth of investment as Minister of Health and NGOs and private sector in primary health care in Kenya. And so we know what the solutions could be. And then we come to the financing. So there's a little bit of the Minister of Finance. We do the $10 capitation fee. So here you do $10 capitation fee, which should be okay for the basics. But now you're going to improve care. So you're going to increase demand, and you're going to do new non-communicable diseases. And the government is telling you, here's $10. You take over the risk to invest in this, and get paid over the next 7 years. And we're not quite sure where the money is coming from, but there are going to be lots more patients coming with more healthcare problems, and it's on you. Who's doing the modeling for that? And so is my bank or our investment committee at Philips saying, yeah, that's a great idea. Take that one. And the out-of-pockets are going to be 60% of that income. So how do I get the out-of-pocket of a pregnant woman who's going to go to the clinic and pay that fee all the way to Amsterdam? That is pretty innovative. So I agree with you. That's the complication. It's not the technology, it's not the willingness, it's getting the coins going in the right direction.
I want you to be able to
No,
rebuttal
I just would
here.
make the point, my issue with the term innovative finance isn't an issue with innovation. I think innovation's a good thing. It's an issue with the idea that somehow there's a type of financing that is not constrained by all the other laws of gravity that exist in finance, and if we could only find that, all our problems would be solved.
Agreed.
I am going to get in big trouble with a couple friends in the back row, because I don't think we have time, actually, Marianne. I'm worried about our schedule here, unless it can be like lightning, like tweet length.
Yeah, actually, maybe this is a good conclusion.
Yes.
Kay Roberts, Maverick Collective, and also PSI, and we have the great pleasure of partnering with Philips and Merck. And I have to say, this has been one of my most favorite panels of Davos. And of course, we've had a long partnership with you as well, Raj. Thank you at DevEx. I would just like to say, as a member of both the NGO community, but also representing high net worth individuals and philanthropists and investors with Maverick Collective, that Dana, I really liked your comment, because with the connecting the dots on speed and efficiency and getting the financing that we need, because we know what the problems are, it's in the packaging of how we bring all this together. And as NGOs, we don't understand the finance world. And we have such great leverage with organizations like Philips and Merck, who've done incredible work in the innovative space. But we need the banks to really help us to understand how to develop these packages. Because I can tell you that every philanthropist and investor that I speak to, they're waiting for that menu of options of where to invest, where to make sustainable investments.
We added
and
another
impact
term,
investments.
Julie, packaging.
Yeah. So that's my quick point that I wanted to make.
Thank you so much, Kate. And I'm sorry to cut off other questions. I just really want to get you guys back to your next thing on time. I hope you take away from the session, before I bring Marianne up, just the idea, as you've heard from this panel, that there are two sides to the coin on private sector. We've got to get the financing side right, of course. We've got to get results.
Yes.
And those two can't be separated. And the results do require kind of a market view of health. And so, we are at DevEx really proud of the report we've worked on with MSD. We hope you take it back and take something from it. It's kind of long and in-depth, but there are things you can tweet out, so feel free to do that. And this is a theme we are on. You will see a lot more coverage from all of us. So I want to thank the panel, but especially ask Marianne to come up and give us some closing thoughts.
And I think we need to thank Raj as well, yeah? So this is two for two in terms of the most interesting panel at UNGA and now at Davos. And so I will take bets on, what our next kind of partnership event will be. We really did want to move the conversation, but not just move the conversation, talk about those nuts and bolts where we can have that action for impact. I do want to bring you back to the report, because Maria Rosa, what you said about language and shared language, one of the reasons I believe that we're not measuring this is because we haven't come together to have a consensus around what it is that we're going to measure. And to Julie's point, we will never be able to hold ourselves accountable for results if we are not measuring and tracking that. And we're not going to get to that must-have 2030 if we are not constantly looking at whether we're hitting our targets and our goals. And so that's the call to action to all of you. The next time DevEx does this report, that last column that was all blank will now have green check marks, yeah? So be prepared for the call because the next time we get together, it will be to identify what those common metrics are so that we can track our progress together. The last thing I want to say besides thank you is watch this space, stay tuned, because all of these things that have come up in the conversation together, Merck for Mothers is open for business as unusual, and we're going to make it happen. So thank you.
Yay.
Hi. Yeah, madam. Yeah.